All right, so let's go ahead and get started. So, hey everyone, I'm Miles Kerwin. I'm from H1. We're recording the session today. For folks that weren't able to make it, we'll share it with the rest of the network. Um, First, I would want to thank everybody for joining. We're incredibly humbled by the amount of people that are willing to raise their hand and go and support in harm's way in Gaza and other medical missions around the world. We've got more than 3,000 people who've joined our H1 network. And on the call today, we have almost 100 who are willing to help out. So it's really humbling and really honored to serve you guys and support you in your aspirations to go help out in Gaza and around the world. So today, the purpose of this session is to give you an overview of H1 and what we do. And then we're also going to introduce Save the Children, give you an overview of who they are, their medical missions, and specifically their requirements for their mission to Gaza coming up. So I'm going to start off with a little bit about H1, and then I'm going to pass it off to Save the Children, and then we'll do a little bit of a Q&A at the end. So who H1 is, you can kind of think of H1 as a tech-enabled recruitment agency where we are partnering with different NGOs like Save the Children to connect them with healthcare professionals, nurses, doctors, PAs who want to go and do medical missions and do some good around the world. We're a large team. We're in 3 countries. We have more than 300 employees, and I'll quickly introduce some of the people on the call today. So myself and Lauren, we're leading the recruitment for medical missions in Gaza. Tiago is our overall platform leader and community lead for H1. We have Dr. Weintraub, who's our advisor from Harvard Medical School, and then our CEO and co-founder, Ariel Katz. We're all super invested in this mission to help connect the world to the right doctors and help connect you with NGO partners for medical missions around the world. So we've got a big team and we're really excited about working with you guys. So as I mentioned, H1's mission is to connect the world to the right doctors. So what we do is we profile every doctor around the world and tell you everything you need to know about them. So we're gathering information on doctors from different sources, such as websites, claims data, conferences you've spoken at, different information that we can gather from the web. And we're profiling these doctors to help connect them to different opportunities around the world. On our platform today, we have more than 10 million healthcare professionals. And what we do day to day is we connect doctors to pharma companies for clinical trials. So if a pharma company is launching a new drug, they're launching a clinical trial, they're looking for a certain doctor or a certain site to run their clinical trial as a principal investigator. And we help them make that decision based on the information we've gathered from our doctor network. We also help pharma companies educate doctors on drugs, and that's kind of how we pay the bills normally at H1. We've launched the company in 2017, so we're still a startup, but we've raised more than 200 million in capital. We've got, as I mentioned, more than 400 employees, 250 customers, and we're growing a lot. We've got some of the major pharma companies and life sciences companies as our clients today. And earlier this year, or last year, on October 7th, 2023, after everything that happened in the Middle East, we wanted to use our data and our resources to help out around the world. So we launched this H1 Volunteers initiative to connect doctors from all across the world, from Africa, the Middle East, United States, everywhere, to go support Gaza and Israel and the crisis that's happening in the Middle East. So we reached out to everyone in our network, everyone that we had emails for and contact information, asked them if they wanted to volunteer, and we got an amazing response from different volunteers around the world. So now we're working with them to connect them to Save the Children and other NGOs. So as I mentioned, H1, we're at the very beginning of the recruitment process. So our mission as H1 Volunteers, H1 Connect, is to recruit and connect healthcare professional volunteers with emergency medical missions and health system shortages around the world. So we are that recruitment agency that connects you to the NGO who is running the mission, running the logistics and all that, like Save the Children. We've had a lot of success to date. We've got more than 3,000 volunteers in our network who have raised their hand and want to help out. We've already matched about 10 doctors to support hospital systems after October 7th in Israel, and then to support different NGOs in their medical missions to Gaza. We've reached out to more than 300,000 doctors. Many of them have significant experience, 10 plus years of experience, and many of them speak Arabic and different languages. On the bottom here, you can see some of the partners that we're working with. So today we're going to talk about Save the Children, but we've also done a webinar with Team Rubicon a few weeks ago, Fajr Scientific. We're working with International Medical Corps to help with their recruitment, and different organizations on the ground here, with the World Health Organization kind of being the overall coordinator that we're funneling all of our activity through. And on the right here, you can see the process that H1 does to match our doctors to different opportunities. So we start with identifying needs and shortages around the world. Right now, we've identified a clear need in Gaza, and we're working to fill that need. We recruit healthcare professionals who are interested in volunteering. So many of you probably received an email from us. You might have been forwarded that email on WhatsApp or in some other method. But we reach out to different doctors who we think would be a good fit, and we try to recruit them for the mission. We then screen those volunteers based on our questionnaire. We ask for resumes, for CVs, and your different credentials just to make sure that you're a good match for the NGO. And then we partner with NGOs such as Save the Children to match you to those opportunities. And then we'll support you throughout the process. So that's a quick overview of H1. Again, thank you so much for joining. I want to introduce Save the Children, and we're going to start with Simon, who's going to give a quick overview of their mission and what they're doing. And then we'll open it up to Q&A for any questions you have. We've got an hour for this call, so we're hoping to get to as many questions as possible. So without further ado, I'll pass it off to Simon.
Thank you so much, Miles. And we're really happy to be here with all of you today. First of all, we want to give a big thanks to H1 for organizing and putting us in touch with all of you. And also a really special thanks for all of you attending today. We're so grateful to see all of you attending and wanting to hear more about how you can support, how you can help. And that includes both in Gaza as well as elsewhere around the world, as we'll get into soon. So as an introduction, my name is Simon. I am the manager for Save the Children's external emergency health unit roster. And I also work more generally with managing deployments in Save the Children. As for my background, I've been working with humanitarian deployments now for almost 7 years. So really looking forward to getting to know you better and getting to work with you going forward. So with that, I'll hand over as well to my colleagues, Kate and Katja. So we can start with you, Kate.
Perfect, thank you. I'm just going to share my screen just so that you guys can see a few slides. If I push that one. Perfect. Can everyone see that? Is that all good? Yeah. Perfect. Okay. Perfect. So I just wanted to talk a little bit about us. So as we're part of Save the Children, but we're also part of the Emergency Health Unit. And the Emergency Health Unit was started in 2015 with the idea to deploy deployable teams throughout the world. We have two mechanisms to do that. One of that is through Save the Children. So a country office will ask for support, and then we will go in and support them. Or we can be supporting through the WHO emergency medical teams, which is where a request comes from the government of that country, and we then go in and support in that way. So we can support outside of Save the Children. However, Save the Children is in about 120 countries. So most of the time we are deploying where there already is a Save the Children. And that means that we get a lot of support from people from within the country. We've obviously got local context, we've got local culture, we've got an ability to be able to follow HR rules and laws, banking systems, everything like that very quickly. So it means we can be accountable for the way that we operate very quickly and within that context as well. So this is just a little idea of some of the places that we've been throughout that time. And you'll see some countries are countries that we really do go back to frequently. And you can see that a majority of the deployments that we do are based on the African continent. So you will also find that a majority at the moment of our roster and also of our team are also from and based in Africa, so that we've got that localization when we deploy out where possible.
Kate, it looks like the screen that's being shared is like the notes screen. Is there a way you can go full screen?
Yeah, you don't need to read all of that bit, do you?
Yeah.
Let me have another go. Does that look better?
Yes, perfect. Thank you.
Perfect. Shared the other screen. Obviously, technology is something that not all of us are great at. Perfect. So, why do we go out? Well, basically, as I think we all completely will understand from every country and the country that you're in or working in, there are different levels of health services. And so you've got your type 1s, which is what we would normally in other countries call your primary healthcare centres. That might be your local GP, it might be a mobile clinic, it might be a very small local hospital. That will provide usually 9 to 5 kind of services. And then you go up to your type 2s, which will be a larger kind of potentially like a city hospital, and up to a type 3, which is a tertiary hospital that would have ICU, operating capabilities, you know, that sort of larger context. As Save the Children, what we provide is either a type 1, so that's smaller primary healthcare, or a reproductive, maternal, newborn child health specialized care team. And I'll talk about that more in a second, because that's what we're looking at putting in for Gaza. So obviously, in the event of a disaster, what immediately happens is that some of these units are taken out and we're no longer able to operate as normal. And so a country might request that because we've got an impact with the number of type 1s being knocked out, can we have assistance for more coming in? And that could have been because of an earthquake, or as we've seen in the example of Gaza, where people have been moved down into one area and there's also been a mass amount of destruction of hospitals in other areas. So the existing health system can no longer cope with the population that is now there and the services that they're requesting. What we've also seen in Gaza, and that's an example of other examples like earthquakes and things, is the demand changes. So we've obviously seen a real increase in trauma needs, and therefore a need to go in with a specialized care team to provide particular services, because they're now needed at a higher rate than what you would normally find in that country. So the objectives of the EMT. The emergency medical team was basically set up post 2010. And I think lots of you might remember or know that there was a large earthquake in Haiti in 2010. And what was found from the studies post that was that there was a lot of procedures that were done that weren't necessarily needed to be done, or there wasn't continuity between the different international teams that flew in. And so the idea of the WHO emergency medical teams is that we've all signed up to the same initiative, we've all signed up to the same minimum standards, and hopefully, therefore, the quality of services amongst the different EMTs is the same. And then when we're reviewing back with that service, the government knows that there is quality that is coming in, and it's not just people flying in, you know, doing some of their own healthcare and operating within their own rules. We're all operating on the same minimum standards and principles. It also operates as a coordination. So we're able to reach out and coordinate either with other emergency medical teams or go up to them for advice and support as the coordinating body. I'm racing through because I know there's going to be lots of questions. So if any of you are interested, I can put in the chat the link to the resources, but these are the minimum standards that are set out, and the key 3 that are highlighted at the top are the ones that are relevant for this deployment, and 2 of them are relevant for our other deployments. So the blue one is the minimum standards. That's what we need to achieve to be able to deploy the type 1 and to have basic standards for a specialized care team. The purple book is the one that is specialised for reproductive, maternal, newborn and child health specialised care teams. So that's particular for our services that we want to offer around maternal and reproductive health and child health. And then the red book is looking at that blue book, but in the context of places like Gaza, where we've got conflict, where we recognise that things are a little bit harder, and some things that might be expected as minimum standards might be harder to be able to achieve because of the environment that we're then in. So what was our ask? We were asked through WHO to support existing health facilities, not to bring in additional health facilities. The major request was around trauma. There was also a request for maternal support and also bed capacity. As I think many of you would have heard, one of the major issues is the lack of beds for people then to be able to go in post-surgery. And if we're deployed, we need to be self-sufficient and support the facility to maintain their functionality as well. So that's slightly different to what we normally would deploy with a specialised care team. We would normally need to be self-sufficient, but we also know that there's a lot we can get in country. So, for example, we would normally be able to stay in a hotel. We would be able to buy food in country. We could buy drinking water in country. And we also wouldn't need to support the functionality of that hospital. But we've been asked to help support to make sure that the water and the general life support of that hospital is functioning. So we received the request. We discussed with the country office. We have a country office in Palestine that we then respond to. We conduct a go, no go. That's where we're looking at whether we can deploy and whether we have funds and whether we actually add to the needs. We look at security, we look at the team we're going to deploy, we look at the stock we need, we develop the job descriptions to go out to get roster staff that we need, and then we discuss with WHO that facility that we're going to go to. So back to the specialised care teams. What is a specialised care team? What we want to do is work within an existing facility. So if you look at this picture, everything that is circled here is what we would bring as a specialised care team. So we don't need to worry about bringing an operating bed or a standard thing that we would find in a health facility. What we do need to bring is the specialised people, so the obstetricians, the gynecologists, the anaesthetists, the specialist equipment that you would need to do those procedures, circulating scrub nurses, all different specialities that we might not find in that existing hospital, and then work within that facility. So usually once the patient has had their procedure, they go back to the hospital and the hospital then manage the patient's care. And we would just go and do a ward round, for example, to follow up on that patient pre-discharge. In this facility, we have been asked to also think about a bit of a bed capacity because we need to make sure that our patients have somewhere to go after they have delivered. So we're also looking at bringing in additional beds and staff to be able to look after that capacity as well. So what would you expect if you came out? I really want to highlight our strict security. It really is follow the rules, and we're pretty strict on that. So there is no messing about, because your safety is also really important, and we need to make sure that in a situation like this that we are keeping you as safe as possible. Obviously, depending on where you deploy will also depend on how strict that security can be. Therefore, no movement outside of the pre-agreed vehicles. So if you have family or friends that you know that are within Palestine and you're coming in as an international person, please don't expect that you're going to be able to go off and go and see them. I also want to highlight that, as I'm sure you're aware from the news, our sites are deconflicted, but that doesn't mean that they're not being targeted. So it is incredibly dangerous to be there, and that's something that you need to consider before you decide that you want to deploy. Also, the conditions are going to be very basic of where we're going to be staying. So there will be shared rooms. We will hopefully access the toilet. We might just have the showers that we have, which are bags with hoses on the end. So things will be very basic. And there is also a possibility that you will be sleeping at the hospital, depending on the distance between our head office and the hospital that we deploy in with. So I just wanted to stress all of those little bits before. I'm going to hand you back to Simon now, who's going to talk a little bit about the roster and how you would deploy. And then I can also answer any questions that have come up. Cheers.
Thank you very much, Kate. While you were presenting, I've also been answering some questions in the Q&A, but if any of you have any follow-up questions on that, we can also run through those later. So let me just share my screen as well. So thank you, Kate, for talking about, you know, what the Emergency Health Unit works on and what the EMTs do. I'm going to roll it back a little bit now and give a little bit of a background on Save the Children, as well as, you know, how we respond to humanitarian emergencies around the world. And as Kate said, also how you as healthcare professionals can engage with us through the Emergency Health Unit roster. I think you need to stop sharing your screen, Kate, before I can share mine. There we go. I hope that you can all see my screen now or very shortly. Thank you very much. So, as I said, I'm going to quickly run through who we are, Save the Children. Maybe some of you are already registered on our roster. I know we've gone out quite widely with this before, but in any case, we see this as a really good opportunity for us to present what we're working on to all of you and give you a platform, and a really open platform to ask any questions that you may have. Who are we in Save the Children? Just to, you know, start off, as Kate said, we are the world's leading NGO when it comes to child rights and working towards children's outcomes globally. We have a complete or a truly global footprint. We are present in more than 120 countries, and we employ more than 35,000 staff at present. And really what we are working towards, our vision is a world in which every child attains the right to survival, protection, development, and participation. And that's really where all of us, or all of you, come in. We have a quite ambitious goal that by 2030, children survive, learn, and are protected. That means that the one that we're thinking about here within the health sector is that no child should die from preventable causes before the age of 5. Of course, that's quite an ambitious goal, but something that we're working towards every day. And how do we go about achieving those ambitions and those goals? We have, as a non-government organization, we have our approach to humanitarian action is that we follow we are driven, and our action is driven by the humanitarian imperative, the imperatives to save lives and protect children, alleviate suffering, restore dignity. And specifically within the health breakthrough or the survive breakthrough that we have is that we need to assess the impact of crises on affected populations' access to basic health services, as well as, you know, within water, food, and also shelter. And just the same way that we have a global footprint, at the moment, we currently have 75 ongoing emergency responses around the world in 55 different countries. And in 2023, our aim was to reach a total of 30 million people with our programs, including 17 million children. So again, it's quite wide what we're doing in general. As you can see, though, of course, we go where the needs are. So recently, there's been a heavy weight on responding to different crises and emergencies around Africa and also in the Middle East. So that also means that we need a very wide range of people to help us achieve these goals. So when we're recruiting people for the Emergency Health Unit and for the Emergency Health Unit roster, we need people from all across the world to help us do this. And just to speak a little bit more specifically about what it is that Save the Children is doing in Gaza, So far, since October 7th, we have reached more than 100,000 individuals inside Gaza with cash distribution, non-food item distribution, and also different wash services. And it's been really challenging so far to reach the people most in need inside Gaza. As I'm sure you're all aware of, international access is severely restricted, and it hasn't been possible for us up until now to send in international staff to Gaza. So we've been relying on the existing teams and the existing staff that we had already on the ground to support us in the scale up. I think, yeah, at the start of this conflict escalation, we had around 35 staff inside Gaza already. Roughly half of these now have come back to work, and they're the ones that are now helping us establish a base of operations. Currently, we're working out of Rafah in the south of Gaza. And we're anticipating the entry of international teams, both from Save the Children in general, but also from the Emergency Health Unit. And we're working to set up suitable guest houses, both for national and international staff, so that we can really look to scale up our response. And what we're planning to do going forward, as I said, we're planning to set up a base of operations in Rafah. We will surge in a team of international colleagues that will really work to support and augment the efforts of the teams that are already on the ground. So a lot of the work will be done through our local partners who have access to supply chain, who have access to logistical networks that will allow us to help. We have, as with many other NGOs, we have a lot of trucks filled with different aid lined up along the border in Egypt, the border to Rafah, and we're really working as hard as we can to try to get aid into Gaza. And it's still early days for the scale up of the response in Gaza, so we're quite open at this point in saying that we don't really have all the answers at this stage in terms of how exactly the response is going to look like from Save the Children's side. But of course, we're not going to send you into Gaza without having, a robust safety and security plan, and without, preparing you in a detailed way beforehand. So, as we go through recruitment, getting you on board to the roster, and going through the selection phase for our response team into Gaza, a lot more information will be clear to us, and we will be sharing this with you as we're preparing to scale up the response. But of course, we're open to take any questions that you might have today as well around how a deployment to Gaza is likely to look like. And of course, the terms and conditions as they are now is that our general response teams we're looking at a rotation of going in for 3 to 4 weeks at a time, and then rotating out for a week before then going back in. That might look different depending on the type of response that you're a part of. If we are sending in an EMT, or if we're staffing a field hospital, those rotations might look a little bit different. But again, this information will be clear to us before we deploy any of you into Gaza. Save the Children also takes our duty of care very seriously to all the staff that we deploy. So there will be strict well-being follow-ups and briefings prior to you deploying with us, and also during and after your deployment to Gaza. So there are mandatory safety and security procedures that we have to go through. There's going to be well-being screenings, as well as medical evaluations. And then we're also going to be really carefully following you up after you come back from the mission, so that we make sure that that everything is going on in a sustainable way. So more specifically around the Emergency Health Unit roster and what it looks like to deploy with Save the Children into Gaza. So the external Emergency Health Unit roster is a pre-vetted cohort of medical professionals from around the world that we sign up and register for our roster, and that we deploy alongside the Emergency Health Unit. And the way that the emergency health unit roster is set up is that it's designed to support and backfill the EHU core capacity. And when it comes to the EMT ask for Gaza, this is then we're specifically then going to deploy healthcare professionals such as doctors, nurses, within a range of different specialties, so that they can support the EHU as they lead the response. And as you can see from that, the emergency health unit roster is really a key resource for Save the Children to be able to initiate a direct health response within the first phase of an emergency. So we're really dependent on the capacity within the emergency health unit roster. And as such, we provide a range of different operational support to the emergency health unit roster as well. This current deployment mechanism that you will be deploying through has been operational within Save the Children for more than 5 years now. So it's a quite sort of true and tested and experienced deployment mechanism. I think last year alone, we had more than 1,000 deployments through this mechanism. When you're a part of the emergency health unit roster, you will have dedicated support from a multi-person team, both operational support, logistical support, as well as subject matter and clinical support to make sure that you get all of the follow-up and support you need when you're deploying and also before you're deploying. So, so how it works is that we go through a quite extensive recruitment process where, you know, in this case, H1 will help us with presenting us with any, you know, interested candidates. We will take them through our recruitment process, and for the successful candidates that meet our criteria, I will speak more to that soon. We will take you through a really good onboarding and induction process so that you get to know the organization a little bit better, as well as get prepared for the type of work that you might be expected to do. And of course, there's, even if you are on the emergency health unit roster and we ask for your availability, there is no specific requirement for you to deploy at a certain interval or at a certain number of times per year. All deployments with the EHU roster are completely voluntary, and turning down a deployment, either because you're not available or because you're not interested or comfortable going into that specific deployment, it will have no negative consequences for your future deployability later on. So there's really at no point in the recruitment or the availability or the selection process for deployment, it's still completely optional for you to go forward, and there's no you don't have to commit at any point until, of course, we launch the response and we put you on a contract, at which point, of course, you do commit to deploying with us. So we are aware that H1 works a lot, you know, in terms of volunteering, but just to be completely clear that when you deploy with Save the Children through the emergency health unit roster, we will put you on a consultancy, a short-term consultancy deployment contract, which means that while you are deploying with Save the Children, you are, for all intents and purposes, considered a Save the Children employee. You are employed by Save the Children while you're deploying with us. And that means that you will be receiving a compensation and you will be receiving benefits. You are completely covered by our travel and medical insurance while deploying. And we will cover all costs related to the deployment. So that means that if there's any vaccines you need to do, if there's any medical checks you need to do, we will cover the cost of that. All travel-related costs are going to be covered by us. And of course, we will also cover your cost of living while you're being deployed. So you will be on contract with Save the Children while you are deploying with us. And to talk a little bit about, you know, what does a typical deployment with Save the Children look like? They can vary to a great extent, but we say that a typical duration of a deployment with Save the Children generally lasts between 1 to 3 months, depending on the type of response, but also depending on your availability. Based on how long you're available, we can then set up a response team, and we could, you know, switch out people for however long they're available. There will be different working conditions as well in different responses. So in a typical emergency response, you're generally required to work 6 days per week while deployed, and then you have 1 day off. Whereas we see maybe when you deploy as a part of an EMT or when you're staffing a field hospital, it's also more likely that we're going to set up rotas for you, so that we make sure that, you know, if you work a 12-hour shift or a 16-hour shift in a hospital, we make sure that you get some time off to recuperate as well. And as I already said, you know, the support that we provide to roster members, we give you a good induction to make sure that you're familiar with our core values, our operational standards, how it is that we're responding. And we also provide you with operational and clinical support, you know, throughout, so that you don't have to feel like you're alone while you're deployed. You will always be a part of a team when you're deploying, and you will always receive administrative logistical support from us when you're on deployment. So especially for your first deployment, we're going to be guiding you through the whole process so that you feel confident and comfortable deploying with us. As I said, we have a quite detailed, tried and tested end-to-end process for recruitment. I'm not going to go through that in detail, but just so that you're aware that once we initiate this process, we have a clear step-by-step process for how to do it. And just, you know, specifically in terms of GOSLA, just to come back to the safety and security and the well-being aspect, we are very committed to the safety and security and well-being of all staff that deploy into our responses. You are Save the Children staff when you deploy with the EHU roster, and we treat you as such. That means that you are, again, you're covered by all procedures, benefit packages, as well as insurance policies that we have, so that you can feel safe that when you deploy with us, we will take care of, we have a duty of care for you when we deploy you. And it's really important for you that when you deploy with us, that you stay safe, and that after the end of the deployment, you want to come back and deploy with us again. That's really our goal when we put you onto the roster and when we deploy you. So I think just for the sake of time, I'm gonna stop there, and maybe we can open up for any questions. Oh, just before I do that, just a couple of requirements so that I can mention that, because I saw a lot of the questions were also about, you know, requirements for joining the roster. What we are currently saying is that for roster members to deploy into clinical roles as doctors and nurses, we do require that you are currently clinically active and that you have the appropriate licenses to operate in your country. So we do clinical license checks. So we know that a lot of doctors and healthcare professionals, they have, you know, they step out of clinical practice and do more operational roles. And we have, of course, operational roles within the EHU roster as well. But in order to deploy into a clinical role, you need to be clinically active. And similarly, in order, like, we deploy staff into very challenging contexts. They're conflict contexts, they're emergency contexts, they're generally low resource settings. So we do also require that the staff we deploy have prior experience from these types of contexts, so that they know, so that you know what you're getting yourselves into, what you can expect when you touch down on the ground. And of course, I said that, of course, deploying with us is voluntary, but we really would wish for you to want to actively pursue deployment opportunities. And if you are have regular contracts either with hospitals or other companies, we would like for you to try to be able to pursue these opportunities, to be able to take time off from your work for a few weeks per year, so that you could pursue these deployment opportunities. But that's something we can talk more in detail about, you know, when we go through the recruitment process. So I think with that, we can open up for some questions, or if there's anything you would like to add, Kate or Katja.
Nothing from me. I've just answered some of the questions coming through, and I know Katja has done the same. So yeah, I think if there's any questions that people have.
Happy for anyone to jump off mute and ask any questions directly to us as well.
Yeah, so I think the best way to handle this is For everybody, for all the attendees, please review the Q&A if your question has already been answered. But if you have another question that you think applies to the whole group, just raise your hand. You can raise your hands by clicking at the bottom there or clicking on your name. And then if I see your hand raised, we'll allow you to speak.
Sounds good. Maybe we could just go through some of the open questions in the Q&A in the meantime.
I think, Simon, sorry, I was just going to say, I think one thing just to highlight is on security, because there's been a couple of questions around that. So we obviously will work, Save the Children's offices, accommodation, and the health facilities that we work in are all deconflicted sites. However, as I think you are all probably aware from the news, that hasn't meant that they are safe locations to be in. So as much as we will work to ensure, and I said very stressed in mine, strict security protocols that we will have to follow, it is very important that you are aware that this is a very complex situation. It's ever changing, and some of the humanitarian laws that we might normally follow, such as deconfliction, are not being followed. So it is important to factor that in when you're considering deploying to Gaza, as opposed to some of the other locations that we go to, where there is a lot more recognition around deconfliction.
Absolutely, and of course we recognize that Gaza is a high risk context at the moment, a very high risk context, and we will do everything we can in order to prepare you for the types of challenges and risks that you might encounter when you deploy into Gaza, and what our mitigating actions are, and what you can do personally as well, or as a team, to mitigate some of the risks that we will encounter. We are quite well established with doing humanitarian response in high risk settings. So we have a very robust and strict safety and security policies. We have a very professional safety and security teams that are supporting us and making sure that we're not being sent into a situation if we can't, at least to a certain degree, say that we are taking care of the safety and security of the staff that are deploying. But of course, also as mentioning, at the end of the day, everyone is ultimately responsible for their own safety and security, because because we can come into situations that we cannot stop or mitigate completely. So, but that being said, of course, we are taking every precaution possible to make sure that deploying into Gaza is as safe and secure as possible. And we also have requirements, that prior to traveling, you need to have a safety and security brief with the team in country. And we also require that everyone deploying with us to Gaza, they need to do an in-person hostile environment awareness training, a heat training. And that's, of course, if we confirm you for a deployment to Gaza, that's something that we're going to cover the cost of, and your participation in that, just so that you're aware.
Great. Thanks, Simon. Well, let's go to a few of the hands that are raised here. So again, please ask a question that applies to the whole group, and if it's not in the Q&A already. So let's start with Collins Lando. You had your hand raised.
Thank you very much. I've followed the discussion all over, and it's good that what I wanted to be addressed, some have been addressed, especially matters to do with security. My interest now is on, this can be a matter of evacuation, and actually as people who are willing to join for volunteership from Kenya. And I worked during COVID, and evacuation sometimes is complicated, but if in case there will be a programmed way of doing it, then it's going to be possible. My question is, some of the people who are willing to go to Gaza for this evacuation, are they going to be assisted on getting passports?
Or visas, you mean?
Yes, the passports and the visas.
Thank you for that question. That's a really good question, both in terms of the of evacuation, but also obtaining an entry visa to go to Gaza. It's one of the main challenges that we have currently is that, as you're all aware, entry restrictions into Israel and then in extent also Gaza are very restrictive. So at the moment, we are seeing, our experience is that applying for a visa to enter Israel or Palestine at this moment, it takes a long time. And because of the ongoing conflict, these processing times are just, getting extended. So in the first phase of the response, we are forced to prioritize passports or nationalities that can get a visa on arrival for Israel and Gaza. And we know that this greatly restricts, the nationalities that we can deploy in the first instance. But that's something that we're seeing, unfortunately, as a requirement now, because we are simply not able to obtain visas for staff that have to apply for that. In terms of evacuation, as you correctly said, it's not always, again, due to the access and travel restrictions, it's not always easy to ensure quick evacuation. However, of course, we're not going to deploy anyone into Gaza without having a very clear evacuation policy. And what that also involves is that we're going to have a very clear security and hibernation policy, so that while we are waiting for people to have the opportunity to be evacuated, we have safe areas where they can hibernate while they're waiting for that. And that's something that we have experienced from recently with Ukraine, where we were facing some of the same challenges when staff needed to be evacuated. That, we have to see what's possible and then make sure that in the meantime, we have really good policies on that. And we also saw the same earlier this year when the border between Gaza and Israel was shut due to a security concern. We had multiple staff inside Gaza that had to wait for a few days to be evacuated. And then we saw that our hibernation policies really worked and that we were able to keep our staff safe while they were waiting to evacuate.
Great. Thanks, Simon. And I guess to answer the first question, I imagine there are some people on the call here that don't have passports. Some people from certain countries in Africa. I don't believe that we're supporting or helping in obtaining a passport, correct, Simon?
No, that's one of the prerequisites of deploying, is that you must be physically available to deploy. So while we would help you out, of course, with any visa applications, we would require that you already hold a passport.
Right. And then we've got a few other questions in the chat that I just want to address on applying. So I put the link to apply in the chat a few times. If you've already filled out the form, then you've done everything you need to do. We just ask that you keep your profile updated with the most recent information on how many weeks you're available, when's the earliest you can leave, your latest CV and your resume. And from there, we're sharing all your information with Save the Children. And we're helping them vet those volunteers. And if your profile is selected for an interview, then you'll hear from Simon or Kate or somebody from the Save the Children team. We'll make the introduction, and then the process will go on from there. So at this point, there's no applying directly to Save the Children. Just flow your applications through H1, and then we're sharing those applications with Save the Children. So we've got a bunch of hands raised. Let's start with Charles. I'm going to unmute you, Charles. You want to ask your question? Charles, do you want to come off mute? Okay, let's move on to Brino.
Hello?
Oh, hey, Charles. You want to ask your question?
Hello? Yes.
Yes, we can hear you.
Okay. Thank you, Simon, and the rest of the team for the presentations that you have given unto us. I'm from Malawi. My question is mostly on the presentation that Simon made, mostly on the requirements. he talked about for you to be eligible, you have to be clinically active. But as we know, the field of nursing as well as clinical, we do have some qualifications. There are some certificates, there are diplomas, there are degrees, masters, and so on and so forth. I don't know. Would you just explain on the qualifications mostly that can make someone to be eligible to join the team? Thank you.
Absolutely. Thank you for that question. I can try to respond a little generally, and then if Kate can also jump in if she has more specific information. But as you said, we of course require that you have the relevant, academic credentials, that you are educated as a nurse in your case. And also that you hold an active clinical practice license. And how we ensure that is that during the onboarding process, we use a partner to initiate a clinical license check, where we collect your academic transcripts. We ask you to submit your practice licenses, and then we also have the chance to follow up and do these checks whenever necessary. So I don't know if there's anything you would like to add to that, Kate.
I think more Katia, I'm going to pass over.
Hi, everybody. I'm the senior clinical manager for the emergency health unit. I think what's important to mention is that when we are looking at CVs, we're looking for clinicians that have, experience, basically more than 2 or 3 years at least of independent clinical experience as they're in their specialist areas, and preferably who have been either deployed or who currently live and work in settings that are considered humanitarian settings, because that's it can be very disarming to do a first deployment into a humanitarian setting. And oftentimes I've worked with MSF before, and oftentimes physicians and clinicians do not react well to insecure settings and hostile environments. So that is the reason for that specific requirement, and it also gives you a better understanding of what you will face in terms of low resources. Kate, anything else you'd like to add?
No, I think that's exactly it. But also, please keep in mind that by keeping your H1 profile updated, for example, there is a current rise in cholera in Zambia at the moment, and that's something that we're looking at as well. So just because this might not be the deployment for you does not mean to say that this doesn't mean that we won't be working with you in the future. So please do keep that profile updated, because then it's quick for us to reach back out to H1 and update any job descriptions and profiles that we need.
That's a really good point.
Yeah, thank you.
Although this call is mainly about our scale up of the response in Gaza, as we said, we are generally interested in healthcare professionals from around the world that can support with any of the responses that we're planning to set up.
Yeah, and just to add on to what Kate said in terms of the EMT and what we're planning for Gaza, the emergency health unit deploys in several other modules. We also work with mass vaccinations. We work in outbreak responses. We do outpatient units for both primary health care and sexual and reproductive health. So we do need quite a wide variety of clinicians and specialties to support that.
Can I just butt in with one thing quickly? Frederick Chihuahua, and I apologize if I've got your name wrong, Frederick. You've asked a really valid question, that you're based in Malawi. You're interested in the length of deployment, which I think Simon mentioned is kind of 1 month up to 3 months. But you've also asked how you manage issues of racism within the team. And so I'd just like to answer that, because obviously that's very important for us. We do recognize that some of the places that we deploy, the understanding of different races is not what we would expect. And that is something that we absolutely do not tolerate. So when we know we're going to a country where We do expect a concern in racism. We will discuss that with the people being deployed prior, but we would absolutely not condone it. So any act of racism would be taken absolutely seriously. And if it's amongst our team, that person would immediately be removed from the team. So I just want to highlight
And I
that.
think
It's really important.
It's very important to highlight as well that within the core team of the EHU, we are an immensely multicultural team with people based everywhere from Pakistan to Mexico to DRC. So our team has actually worked very closely together, and one of the other requirements that we ask of people is that they're very comfortable working in multicultural environments, because that is exactly what we are.
And that's also other diversity as well. So yeah, racism obviously is a part of it, but also your sexual orientation, your gender, all of that is considered very important for us to support you and enable you to be able to do your job as a clinician properly.
Absolutely. Well, thank you for raising that. And just to add to that, you know, that we have very clear anti-racism and anti-discrimination policies within Save the Children, which means that we also have very clear processes for how to report and escalate these types of situations, so that we make sure that we can escalate these concerns within the organization, and that we can take action to follow up on something or an incident that has happened.
Great. I think we have time for one more question, and then unfortunately we're going to have to go. But please reference the Q&A if we haven't answered your question already. So Brino, do you want to go next?
Yes. Yes, I would like to ask some two questions.
Great.
Yeah. So first and foremost, thank you, H1, for giving me an opportunity to join this important webinar. I missed the last time's webinar, but this time around, I said no. At least I should, you know, I should make it happen. So I've followed the whole meeting up to this time around that we're asking questions. Yes, basically, I'm Brino Chuma from Malawi. My first question is that what are the specific specialties that you are looking for? Is it that you are looking for general practitioners? You have been mentioning as in doctors and nurses as an umbrella, as something that is in a closed cage. But if you can even check from the messages that people are asking, some are even mentioning their area of specialty. So do we have special specialties that you are looking for? For instance, in my case, I am a mental health nurse by profession. So do we really need mental health nurses or other specialties that haven't mentioned, haven't been named in the presentation? The second question is there an opportunity that one can work from his country of origin? For instance, as us mental health nurses, you know, you can have a client and you can chat to the client virtually. It can happen. So is there that opportunity that you can work whilst you are at home? Thank you very much. That's the questions that I have.
Thank you, Brino. Just to answer the last one first, I mean, while we would generally say that working remotely is something that we are open for, I think in this case, we do have to say that you have to be available for physically deploying, because you would be deploying as a part of an EHU response team that's going to be physically implementing a health program and delivering medical services in a country where we're doing a response. On the first question about what specialities we're looking for, I think mainly at this point for Gaza, we're looking for anesthetists, obstetricians, pediatricians, midwife, pediatric nurse, as well as a range of different general nurses. Those are the main specialities we're looking for here. I don't know if you want to expand on that, Kate or Katja.
I think we can also include perioperative nurses and scrub nurses, people with experience in sterilization procedures as well.
Okay, well, I think that's all the time we have for today. So thank you all for joining. I am putting the link to the application in the chat one more time. So as we mentioned, please continue to keep your profile updated on H1. Please upload your resume and your CV if you've not already. I want to thank Simon, Katya, and Kate for joining from Save the Children. Really appreciate your support. We're excited to partner with you. And thank you all for joining today. And we'll be in touch. We'll send out this recording tomorrow, along with some more updates. And as I mentioned, if you are selected for an interview with Save the Children, you'll be hearing from us over email. But thanks a lot, and talk to you soon.